Welcome to another episode of Tips from the Top. My name is Rick Barron, and I'm fortunate today to be here with Dr. Kathleen Chard. Dr. Chard is the Associate Chief of Staff of Research and the Director of the Trauma Recovery Center for the VA Medical Center in Cincinnati. Welcome, Dr. Chard.
Thank you.
Thanks for joining us today.
Absolutely.
Would you please share a few details about the leadership positions that you're in at the VA with our audience?
I'd love to. So my newest position is the Associate Chief of Staff for Research, and in that role I orchestrate, supervise the staff that helps make research happen at the VA. And I think a lot of people don't realize that we actually have a very vibrant research program at the VA Medical Center, often in conjunction with our University of Cincinnati and our Cincinnati Children's Medical Center.
How big of staff, how many people directly report to you?
So in terms of the newest position with Research Service, I supervise about 7 people that directly do the research, but then I also have supervision over all of the researchers. So when I'm doing evaluations, I'm doing about 30 evaluations just in Research Service. And then the other position, which is Director of the Trauma Recovery Center, we have 34 people that are actually working focused on treating post-traumatic stress disorder in our returning veterans.
Wow, I mean that's over 40 people that are direct reports.
Absolutely.
That's pretty significant.
Yeah.
The VA's been in the news a lot lately, and I know that everybody's curious as to how what's in the national news affects us here locally. What's going on, what's going well for our servicemen and women down at the VA Center in Cincinnati?
So it's actually a very exciting time, I think, because there is a lot of interest, and so there's a lot of attention to providing the best care to our veterans. But unfortunately, I think the VA has some of the same humility that perhaps Cincinnatians do in general, and that we don't always tout what we're doing so well, so you don't get to hear about it. But we are one of the leaders in the nation in actually something called the tele-ICU. And this is where we can have a staff of nurses in a room with computers monitoring a patient in an ICU in a hospital 500 miles away.
Wow.
And that's huge because that allows you to shorten the staffage at that hospital somewhere else. But also when you need to cross-check an injection, you can have a camera on that needle to make sure that the injection going into that patient is at the exact right amount at the exact right time. Or if there's an emergency, you've got a staff right there monitoring multiple patients, and we're doing that all from Cincinnati for several different states, and we're growing in leaps and bounds. So
is this a new program?
It's an absolute new program, and we're the leader in the nation on it. We're also one of the leaders in the nation on the treatment of post-traumatic stress disorder. So we're part of a 17-site study, $10 million, looking at the 2 most evidence-based treatments for PTSD and comparing them head to head, because we want to finally answer that question of which treatment is better for which person. And we're going to be able to do that by having 17 different VAs participate in that study. And Cincinnati, again, is one of the leaders of that entire study.
That's great to hear. I have a few personal friends of mine that have treatment down at the VA, and they just speak nothing but great things about the kind of treatment that they get and the services that the VA provides them.
We do try. We definitely do try.
So it's great to hear that we are out in front, and that we just need to step out a little bit more and talk about.
I think that's exactly right.
So this helps facilitate that.
And thank you for that.
Yeah, this helps facilitate that. I know, Dr. Chard, that you've got a national role with the VA to support veterans with post-traumatic stress disorder. You're an author, you're a journal editor, you're a researcher, you're a professor. Now you've got 2 full-time jobs. What drives you to do so much?
You know, I knew in 8th grade that I wanted to help people who were stressed. I decided very early on I wanted to be a psychologist. Now, I had no idea that was going to lead me to veterans and to the research position I have, but I think the drive is anything I can do on any given day that is going to help someone who has been stressed by other people, the environment, natural disasters. That's a good day. And as long as I can go home at the end of the day and know that something I did through my research, through my speaking, through my administration, helped one more person get through that stress, get over that stress, handle that stress, or get to someone who can help them, then that's a win.
That's great. Based on the research and your experience, what is the most stressed profession?
Well, unfortunately for a lot of folks, they are in stress every day and perhaps don't even know it. I think some do and some don't. But we have people who are firefighters. We obviously had the horrible tragedy recently here in Cincinnati of losing a firefighter. We have police. We have, EMTs, ambulance. We have a lot of professions who put their lives on the line every single day. And they experience a great deal of stress. And fortunately for us, they do a really good job most of the time of handling that. And so, the more support we can give to them, obviously, is the better. But we also have professions that are stressful, like being a nurse or being a doctor. It's very stressful to lose someone that you care about. Or one of the professions I like to talk about that often doesn't get enough attention is veterinarians. Every single day they go into the job having to sometimes tell someone the horrible news that their most beloved animal needs to be put to sleep, or having to deal with a dog that's been hit by a car or a cat that's been mauled. It's a very stressful profession what they have to go through, and sometimes I don't think they get the support that they deserve for the work that they do.
And are the tools that you're helping pioneer with veterans, are you going to start seeing those spill over into treatments and other types of services for us normal masses as well?
Absolutely. Well, and the wonderful thing actually about the field of PTSD is we don't operate in silos. So the people that are working in China after the earthquake that buried that elementary school are the same people that are working with the veterans, are the same people that are working with our child sexual abuse survivors. So we're all talking the same language and making sure that when we write a treatment manual, when we create an assessment measure, that it's not just for that one group, that it's something that can cross over. And I think that's the importance of the work we're doing at the University of Cincinnati in the Stress Center, is that we can be treating civilians who've been through all sorts of horrible traumas with the same exact treatments that my staff are doing down at the VA. And they work equally well.
Great. You're creating some awful big shoes to fill. 2 full-time jobs, all of the extracurricular activities that you do on top of that, 41 people reporting to you. How are you selecting and mentoring people that will be able to come in behind you and to fill those gaps that at some point in time, that as you move on or move up, will leave for them?
Absolutely. Well, I think I borrow a lot from other leaders, so I listen and take bits and pieces. And I think some of the best advice I've gotten is hire people that are smarter than you and hire people that will tell you when you're wrong. And I think those 2 things have kept me moving forward better than anything. Because if I hire only the people I train and I move up only the people that I train, then all I do is create a bunch of yes men and women. And what I really need is that person who says, Kate, that was a really bad call. Let me tell you why. And I know that's the person I can trust the most to have my back, that's going to help move us forward, that shares in the same mission. You really want that person who comes up with a great idea that you can then forward because you're in your position of authority. So I'm always looking for that fresh, new, energetic person who's hungry for administration, but also is willing to let me know where we're missing and where we're hitting it right.
A lot of times when we sit here and I speak to leaders, they talk about personal responsibility. People need to step up and essentially do more. I mean, is that what I'm hearing from you? Is that, these people that are willing to take risks, these people that are willing to step up, those are the kind of people that you look for?
I think that personal responsibility is important, but I think as leaders, there's something that we all can do. And whenever I've taken a new position, there are 3 things I ask of every employee, no matter how high or low they are on the totem pole. I say, describe to me what you like about your job, describe to me what you don't like about your job, and most importantly, describe to me the talents you have that we are not utilizing. And so I think personal responsibility also is it mine to make sure that I'm using my people well and that I know my people well enough to know where I'm not using them well. But they also have to tell me. So if they walk in the door and say, I'm great, I don't need anything different, well, this was your opportunity and you didn't take that. They do have to have some responsibility to share with me.
In terms of steps that you've taken in your career to help you reach the heights that you've achieved, are there things that you can share with our viewers that they may be able to get some insights from?
I think some of the biggest things are, attending workshops that ring a bell for you. There are a lot of wonderful opportunities. Cincinnati is a gold mine of even mid-level management talks, speeches, opportunities for collegial sharing. Take those opportunities. Watch shows like this to get tips, because you never know when that one nugget is going to resonate for you. And I still remember one of the most favorite things I've heard, and it was about an executive who said, we all are juggling a lot of balls. It's knowing which ones are rubber and which ones are glass. And I thought, that fits me to a T. Now that may not fit somebody else, but certainly for me, knowing which ones not to let drop is pretty doggone critical in my job, right?
Right, yeah.
And so I think it's taking a lot of opportunities to get to know the different people. Reading can be helpful for some, but I'm not going to say it's the anecdote for everyone. Sometimes it's listening to someone, but also take an opportunity to find leaders who are interested in mentoring. And don't just follow them around, ask them questions. Do the exact interview you're doing with me with them privately one-on-one and hear from them, because there are some phenomenal senior leaders in this town, even retired folks, who would love nothing more than to tell you the mistakes that they made that you shouldn't repeat and the successes that they had. And that's worked so well, even if I just buy them lunch and I listen to them for 2 hours.
Yeah. Anybody specifically you want to reach out to and thank?
You know, there is someone actually who was absolutely wonderful to me, and he's not in this town. He's the director of the Wilkes-Barre PA hospital. He was the director of the area PA, and he was my mentor and let me come and follow him around and do phone calls with him. And he did one of the most wonderful things ever. He sat and watched me answer my emails, and he gave me feedback on how I was answering my email and how it was slowing me down. And I literally shaved, I think, over an hour off my schedule some days by just following his simple step of only read an email once. Only once. Simple thing, but boy does it save time, and so many of us don't do it. We think, I'll come back to it later, and his answer was, don't click on it if you know you're not going to have time to do it.
Right.
Right?
Yeah, that makes great sense, because what it does is it dramatically increases your productivity.
Absolutely.
Allowing you to touch things once.
Absolutely, and if you know you're not going to have time, why are you even looking at it right now? You just wasted, yes, it could be 30 seconds, but if you have 25 of those, that's a lot of 30 seconds.
Absolutely, yeah.
Right?
Yeah. I've been to Wilkes-Barre, so I understand.
Yeah, exactly.
I spent time at P&G's plant there in northern Pennsylvania.
Absolutely.
Yeah, yep. One of the questions that I like asking guests is, and I know this won't apply to you because you're not old enough, and that is, roll the calendar ahead and you're sitting with your 10-year-old granddaughter. Okay. And you've got a couple of minutes to share with her, your golden nuggets on leadership.
Right.
I mean, what do you share with her about those little things that may be able to shortcut her success? Right.
I think about this a lot because I have 2 very young children, so I'm going to be very old when I have that granddaughter. But even thinking about my 2 very young boys and what I would share with them, I think a lot about trying to make sure they don't forget the personality aspect of leadership. These are people. Even your worst employee has a method to their madness. And if you can understand why, that simple why, you're going to go a long way to shaping their behavior. Right? And so many of us just get frustrated with, I don't want them doing it, I don't care why they're doing it, just don't do it. But if you understand why, then you've reached their motivation. And once you know what motivates someone, then you know how to change somebody, right? You find out if money motivates your employee, right? Well then, right, you give them raises, you give them bonuses, you give them movie tickets. But for some of our employees, they want an email from you saying, I think you did a great job. Or in the morning, they want you to come in on Monday and go, how was your weekend? And for you to remember their wife's name, right? When you understand motivation, you understand 90% of the game. So I bring a little bit of psychology into my leadership.
What I hear often from guests is that it's the soft skills that matter most.
Absolutely.
And is there a way that you have found to best develop those soft skills, to best practice those soft skills? Because at least based on, I'm sure, the degrees that you have and the kind of work that you do, it can be very factual and analytical. And how do you build that? How do you build those skills?
Well, I think the first thing is you got to get in touch with what you want. What have you wanted as a leader? What have you wanted from bosses? And what kind of recognition have you wanted? But then also talk to people you actually like and care about and ask them, hey, what have you enjoyed most. And when you start to understand that your friends aren't just like you and that they've wanted other things, it really helps you get in touch more with your own humanity and the fact that it's not a one-size-fits-all model. But I also think, you know, understanding that we're all people in the same struggle to get to wherever we're going. And the end result might be totally different for you and I, but we're still all trying to get there. And the more that you can understand that human condition, I think the more you can get in touch with being there as a leader and being more in touch with your soft skills. Because I think you're exactly right. Most leaders struggle with that one area more than any other. And more consultants are brought in to help leaders with the soft skills than with reading their emails or with managing a meeting. Right?
You're watching Tips from the Top. My name is Rick Barron, and my guest today is Dr. Kathleen Chard, the Associate Chief of Staff for Research and the Director for the Trauma Recovery Center at the Cincinnati VA.
Thank you.
Dr. Chard, you're a professor.
Yes.
And you have an opportunity maybe to straddle a couple of different worlds. Mm-hmm. Do you see any, let's start with similarities between kind of public service leadership and leadership in academia, and then potentially any differences?
Yeah. Definitely, I have seen style differences. And I think in public service, there's always that overlay of being there for that greater good, right? People willing to do it because they care about the veteran or they care about the trauma survivor. And so I think there is that piece that overlays everything and gets brought into the decision making. And then say in a hospital or in an academic setting or even some of the businesses I've worked with, there's more of a what is the mission of that? You know, what is the mission of that business or what? And that shapes everything. Vision is critical, right, to leadership, because you're really going to want your leadership and your employees to be following that vision. And so I can see some places I've consulted with where it was really about the money, not about helping the individuals. And that really affected the staff, because when they went in to do, even in a therapy setting at a hospital that wanted to make money, they didn't feel like they were being valued for the therapy work that they were doing if they didn't get enough patients seen. And that's really going to change the tenor of your staff. So I think having a vision that represents what you believe in, but also is something that your staff can get behind, is really important.
Good point. I mean, it's really about helping people see where they need to go.
Absolutely. And even, you know, a company like Procter & Gamble, you know, you've got to have a vision in P&G. And there are people I know personally who work for P&G who say, I believe in my brand and I believe in what we're doing. And you can see the energy that they bring to work every day because they do believe in that. And that's wonderful. But what if you're just going in because you're told to and you're punching a clock? Boy, does that affect the person's performance.
Sure it does, yeah.
You know?
Dr. Chard, you're also the director of the UC Health Stress Center. What kind of role do you serve there?
So my job at UC is to manage a stress center that we created thanks to the Joey Votto Foundation for individual civilians who have been stressed by different events, and also service members who, for instance, might not be eligible to come to the VA, and give them the same quality of care that we have in the VA at the university. Because I noticed in Cincinnati we really had an absence of evidence research-based treatment for post-traumatic stress disorder for civilians and who are adults. We really just didn't have a place for them to go. And thanks to the Votto Foundation, we were able to create something just for them.
So this is more, as we were discussing earlier, the reapplication of the tools and the techniques that you're pioneering with the veterans and doing it right here in Cincinnati.
Absolutely, absolutely. And we're one of the few places that has this. I mean, there's places like Boston, which have home base, which is the Boston Red Sox, and we have the Atlanta Braves, who went in with Emory Hospital and created Braveheart, and here we have Cincinnati with Joey Votto Foundation and the Cincinnati Reds Community Fund, who've contributed to our own UC Health Stress Center. So we're in the big leagues with some pretty big teams. And
did they come seek you out to lead this?
Correct, correct.
That's got to feel pretty good.
It's wonderful. It's a great honor.
Yep. I mean, in terms of the organization there, do you have an organization there that you lead as well?
Absolutely. So we're very new. We just opened back in July, and we already have a whole cadre of staff and then students that we're supervising. So we have another 5-6 people that are working there at this time. and
And
growing.
this is more kind of clinical treatment?
It is clinical treatment and assessment.
Okay.
Helping people know, do I have PTSD, do I have something else, and can I get care for it? And we're also working with children and families there, so it's really a joint effort with Children's Medical Center so that we can treat kids as well and family members who've suffered through PTSD.
Wow. That's great. If you look back over your career, what did you want to know 20 years ago that you know now?
You know, I wanted to know that there was a way to treat post-traumatic stress disorder that wouldn't require someone to be in 3 years of therapy. I wanted to find a way to help people get better and get better quickly. And we are there now. We treat PTSD in 10 to 15 sessions for 70% of all people. And I just think it's phenomenal, the advancements. And I don't think people, they want us to be able to treat everyone now with a pill and make them all better. But I don't think people realize how new the field of PTSD treatment research is and how much we have accomplished in a very short amount of time.
Right. My wife's grandfather just passed away this past week at 96, and he had an opportunity to serve in World War II. Yeah. And when you talk to people from that generation, they just brushed all those experiences aside, right?
Absolutely.
I mean, that was a different chapter, not something I really want to talk about, right? And so I think probably a lot of opportunity as those people wind down their years to maybe engage in the kinds of things that the tools that you've got and the techniques. So maybe that there can be some peace.
Absolutely. We actually did just treat a World War II veteran using tele-mental health. So he was at a completely different clinic in front of a computer screen. My therapist was in Fort Thomas, Kentucky, and a World War II veteran came in, did this therapy, and he was amazed and couldn't believe he'd spent his whole life managing the symptoms of PTSD when he could have felt better, and was just thrilled with the outcome from this.
Wow.
So it really is a wonderful thing that we can provide both to our young returning service members, but also to some that perhaps have been just doing the best they could for a long, long time.
Yeah. You've been able to accomplish a lot.
Thank you.
What's on the agenda for the next 20 years?
Well, I don't know if people realize this or not, but there is a building going up behind the Cincinnati VA that is a research tower. So we're building a 6-story research tower. So we're really expanding on the research that we do here. We're hoping to move into the areas of both cardiopulmonary disease and heart disease and infectious disease, some things that have really affected our service members, along with the work that we've done in traumatic brain injury, substance use, and of course PTSD. So we're making some great strides here. People may not even realize we've got 3 Wolcott Award winners. This is a National Clinical Excellence Award from the VA, and 3 winners at our own VA from across the nation. So some great things that have happened here, and we really just hope to build on that and expand that. And for me personally, it's going to be continue to do the same thing every day. I will continue to help as many people as I can in their quest to get better.
In your role at UC as an educator, are you educating doctors? I mean, who is it? You know, what are your typical students?
So I work with a lot of different student populations. So I work with anything from a young student who's in a practicum for psychology, trying to try on some new skills or decide if they want to work with trauma. I've trained psychiatric residents who are wanting to add to their repertoire as a physician the ability to do cognitive behavioral treatment. I do a lot of guest lecturing to emergency medical service personnel, so firefighters, police, even programs like the airport response team that responds to airport emergencies, working with them to make sure that anywhere we have emergency medical personnel, that they understand what PTSD is. So they understand not only for working with civilians who may have PTSD, but also their own stress. And trying to help those people understand how's the best way for me to personally manage my stress, being that I'm in a very stressful field. So I'd say that right now as a teacher, I'm really trying to do as many different things in as many different arenas, even with nurses in hospitals, and working with them to understand how stress can affect their job, but more importantly, how do they prevent stress from affecting their job.
Right.
And them at home.
Lots of stuff, good, all good stuff. And if we take a look at the golden nugget that you talked about that personality aspect and motivation. Is there words of wisdom that you can give somebody around how to create that personal vision for themselves and really get fired up and motivated about achieving it?
Absolutely. You know, I think so many people are stressed that they don't have that answer. They don't know where they want to be, or they don't know who they want to be, and they don't have that vision. And I think part of it is getting to know you and figuring out what makes you happy and what doesn't make you happy. So first is finding out who you want to be. And then after that, build the vision of what that means. And for me, the vision was follow the job that's going to help, allow me to help as many people as I can. So that's not really a narrow vision, is it? That's kind of broad. But that left me open so that when each job unfolded in front of me, I was in a position to move into that. And then I created a vision that was specific to that individual job, whether it was the vision for the UC Stress Center or the vision for research service at the VA. And so I think a lot of it is people want too many narrow answers for themselves. And sometimes it's knowing yourself well enough that you can create that sense of flexibility so your vision becomes broader and more general. And it's kind of a guiding principle for you, right? And that can be a whole lot of things and can be really exciting, and you can really get behind that, right?
It's almost like go out and then come in.
That's a very nice way to look at it. And I've actually used the expression, I hesitate to say it, but I've used the expression, go and date yourself. And you can date yourself both on an emotional level, but more importantly, go employ yourself, go date yourself, go be with yourself so that you understand your own strengths and weaknesses. I think we get a little nervous about putting that mirror up to the self, but sometimes the best thing you can do is know what you don't do well so that you can either get support in that area or you can just not do that anymore. But if you're not willing to have someone, your close friends, a 360 evaluation, something done, then you're not going to find out what you don't do well and what you should avoid or improve upon, right?
Yeah. Dr. Chard, we only have 2 minutes left. Are there some resources that you can make available through a website, either with UC or the VA, that our viewers might be able to take advantage of in terms of stress?
Yeah, so if people are interested in seeking an assessment for stress, please contact the UC Health Stress Center. We'd be happy to talk with you on the phone or an email, and you can Google us and find us. But also nationally, for those of you that are watching this nationally, please Google the National Center for PTSD. It's NCPTSD. Google them. They have the best resources for family members and for individuals who are suffering from post-traumatic stress, and it will help you help other people in your life that are dealing with stress. Remember, you're not alone, and we do have treatments that work.
Thank you, Dr. Chard.
You're very welcome. Thank you.
Thank you all for joining us today on another episode of Tips from the Top.